Hi, my name is Dr. Jesse Schulz. I'm a physical therapist in Wisconsin. I'm going to be talking to you today a little bit about neural tension, which is basically an entrapment of a nerve or the spinal cord somewhere between the beginning of the nerve, which is at the brain, and at the end of the nerve, which could either be in the toes or the fingers or somewhere in between. You can have tingling, numbness, pain, weakness, abnormal sensation, if you have a nerve that's entrapped. And sometimes it's at the site of entrapment, sometimes it's at a site not at the area of entrapment. I've seen people that have had sciatic nerves that are entrapped that actually have only knee pain. Other people that have had tibial nerve entrapment, which can give them ankle pain. Peroneal nerve entrapment, which can kind of reproduce a symptom similar to an ankle sprain. Median nerve entrapment, which can give you neck pain, elbow pain, forearm pain. And basically, this is one of those things that sometimes is missed during treatment. It can be very beneficial. It doesn't always need to be done. And there is some specific testing procedures that I would really encourage to be done before you just kind of willy-nilly take this on for yourself. So I hope with all that said that you've got someone that told you that you have this if you're going to be trying this video to do some self-treatment. But I hope you enjoy this video, and it's going to be talking about neural flossing, which is basically putting slack on one end of the nerve and putting tension on the other to basically get it to move this way, and then putting tension on this side while slacking here to get it to move this way. Basically flossing that nerve through your tissues to kind of try to break it free. After this, I usually recommend some neural tensioning. It's not always needed, but sometimes helpful. Neural tensioning I do not recommend for anybody who's got a fresh injury. Neural tensioning is basically where we try to gently being the key word, pull the nerve from both sides at the same time to basically try to kind of stretch it through tissues that also may be entrapped in. I cannot stress enough that when you do any neural flossing or tensioning exercise, you should not cause yourself any pain. It should be mildly uncomfortable at the very most. And you should always move as fully as you comfortably can. But I hope this video helps you and at the very least is informative. And thank you very much for watching. This video is going to be about flossing the median and the ulnar nerve. Median and ulnar nerves are two nerves that come out of the lower area of the neck and basically go through the arm all the way down to the fingers. The median nerve goes to generally these three fingers, and the ulnar nerve goes to these two fingers. Not all problems in the arm or in the hand are related to these two nerves, so I encourage you to have thorough testing done if you have any problems in your hand or arm to rule in or rule out this sort of problem. And if you do have a problem with these nerves, it doesn't necessarily mean that they need to be flossed or tensioned either. But if you are looking to floss or tension your nerves, this is one method of how it can be done. So we're going to start off with flossing, basically the nerves in the spinal cord. We're going to be using movements of the neck, the head, the upper back or the thoracic spine, and the lower back and pelvis to basically get the whole spinal cord moving a little bit better. This tends to be, I think, a very good warm-up for the neural system before doing any flossing for the arms or for the legs. So how we're going to start with this is on our hands and knees. If you have any pain in your knees with kneeling, I encourage you to try a pillow underneath your knees that won't take away from the effectiveness of the exercise. If you still are unable to kneel, there are modifications for this, and if you do have a physical therapist that you're working with currently, they'll be able to show you how to modify this. But what we're going to start off with is basically motions of the pelvis at the bottom end of the spinal cord. What we're going to do is let our lower back sag down towards the floor. It's almost like you're sticking out your butt. You're going to hold that for about 2 seconds, and then we're going to basically curl our tailbone underneath us by rounding our lower back up towards the ceiling. And we're going to do this 15 times, holding for 2 seconds at the end of each motion. So sticking our butt out, holding for 2 seconds, arching the back or letting it sag, and then going the other direction. And again, with every motion that we're doing for this, I encourage you to only move as far as you can comfortably, but do move through the largest arc of motion that you can. After we do 15 each of those motions, sticking the butt out and curling the tailbone underneath us, what we're going to do is raise our back up towards the ceiling, our upper back, like you're kind of rounding your upper back, and then letting it sag down. Holding for 2 seconds again in each position. I encourage you strongly to try to keep your elbows straight if that's comfortable for you. Many times I find that people are bending their elbows and straightening their elbows. They think they're moving their upper back, but they are not actually doing that. So if you keep your elbows locked straight, if it's comfortable for you, it's more of a guarantee that you're doing the right motion with your upper back. After we do 15 of those motions with rounding our back up and letting our upper back sag down, we're going to now incorporate the neck motion. So when I round my back up towards the ceiling, I'm going to bring my chin towards my chest. I will hold that for 2 seconds and let my upper back sag down while I look up as far as I comfortably can with my neck. Hold for 2 seconds and reverse. And I will again do that motion for 15 times. Sometimes you only need to do these motions 10 times or less, but again, if this is the first time that you're doing this, I encourage you to do about 15. That way you know for sure if it's going to work or not for you. So the first exercise we're going to be doing is going to be flossing of the ulnar nerve. So to do this, we're going to bend back the 4th and 5th fingers with our other hand, and as we're doing that, you can see that my wrist extended. We're going to be pulling the nerve from the hand, and now we're going to be pulling the nerve from the elbow, and as we're doing that, I'm going to provide a little bit of slack on the nerve from the neck end by looking up towards the ceiling. I'm going to hold this position for 2 seconds, and then relax, bring my chin towards my chest, and actually my head also a little bit to the left. And then I'm going to bend my fingers down, my wrist back, straighten my elbow, and as I do that, I look up towards the ceiling, I hold for 2 seconds, and then again reverse it. My chin comes down, my head goes to the left as my arm is in this position, and then again I look up towards the ceiling as I bend my wrist, fingers, back, and straighten my elbow. And I would repeat that 15 times on the affected side. So this is pull my finger part 2. So now we're going to be tensioning the ulnar nerve. We're going to be pulling it from both ends at the same time gently. And with all these videos on this, we'll say for all the clips on this video, you only want to move as far as you can comfortably. So with that said, we're going to be bending the 4th and 5th fingers down, bending the wrist back, and as we straighten our elbow, we're going to be bringing our chin down and our head slightly to the left. We're going to be holding that for 2 seconds, and then we're going to relax. And then I'm going to again bend my fingers back, extend my wrist, straighten my elbow slowly as far as I comfortably can, and bend my head to the left with my chin down, holding for 2 seconds there. I would repeat that 15 times after I did the neural flossing for the ulnar nerve, which was previously just shown. To fully lengthen the ulnar nerve, what you can do is bend your head away from the arm that you're going to be testing and basically bring your arm back in this position. So what we're going to be doing is another flossing technique for the ulnar nerve. So what we're going to do is I'm going to put my hand on my head with my fingers facing back behind me, and as I do this, I'm going to bend my head to the right, towards the side that I'm doing. I want to bring my elbow not forward, but back as far as I comfortably can in this position. And then I'm going to go relax my arm down and bend my head the other way to pull the ulnar nerve from the top end. Now as it's relaxed from the bottom, and now I'm going to pull the ulnar nerve from the bottom end, the arm side, with my fingers pointing back, covering my ear as I bend my head again to the right. Holding for 2 seconds per position, repeating 15 times. I don't want to hear it part two. So same exercise as far as the motions go, but we're going to be combining them differently. So now we're going to be pulling from the ulnar nerve on the bottom end, the arm end, by pointing our fingers back, covering our ear, and then with our elbow back, we're going to be bending our head to the left or away from the side that we're stretching, basically tensioning the nerve from both ends, trying to kind of stretch it free from what it might be caught on. So we're going to hold this as far as we comfortably can move for 2 seconds and then just relax down to the middle. So I'm going to cover my ear, I'm going to tilt my head away to the left, hold for 2 seconds, relax, cover my ear again, pull my elbow back, tilt away, hold for 2 seconds, relax, and repeat that 15 times. This exercise is called the mask. Now, if you just have problems in one arm from this nerve, you only need to do it with one arm. Sometimes people have issues with both arms, and if you have issues with both arms from the ulnar nerve, as it's been determined by someone who's knowledgeable, you can do this with both arms at the same time. But what you're going to do is you're going to make a little circle with your index and thumb fingers, and you're going to have your other 3 fingers open. You're going to turn your wrist back, your fingers are going to point towards your face, and you're going to make a circle around your eye. So you've got a half a mask. Now if you were doing this with both sides, turn your fingers back, cover your eyes up if you can comfortably, and now you've got a two-handed mask. Now, if you don't have good enough wrist, elbow, or hand mobility to do this, you don't have to go all the way back to fully cover your face. If you can only go back this far, that's okay. But still repeat the rest of the exercise as shown. So what I'm going to do, I'll just do it with one side first. So I'm going to cover my eye up with my hand. And to do flossing, as I've already got the tension on from my arm side, I'm going to bend my head to the right, relax my arm down, bend my head to the left. Now I'm pulling it from the top end or the neck, and I'm providing slack from the bottom end or the arm. And now I'm going to pull it again from the arm side, the lower side, and I'm going to bend my head to the right. I'll repeat that 15 times. If you have the symptoms in both arms, what you can do is cover both eyes up if you comfortably can. You're going to tilt yourself one way with your neck going to the side. And there's no way you can only move your neck with this. So I encourage you to tip one elbow up towards the ceiling and the other elbow down. And then go the other direction if you have symptoms of both sides. Holding for 2 seconds per position, repeating 15 times per side as far as you comfortably can. If you only have symptoms again in one hand, where you don't want to do both hands at the same time, you should also do neural tensioning with the mask for that one side. Which, to do this, you're going to cover up your face with your hand again. And as your ulnar nerve is on tension from your arm, you're going to then bend your head away or to the left. Hold for 2 seconds, relax, pull it from the bottom end by covering up your eye, tilting your head to the left side, holding for 2 seconds, relaxing, again repeating for 15 times the first time you do it. For any of these exercises, if you know it's effective for you, you can see if you can get away with only doing it 6, 8, 10 times, but 15 times seems to be kind of a sure thing if you're going to be doing these. So the first time you do it, I encourage 15 just to make sure it is or is not going to work for you so you don't waste your time. The median nerve goes to the wrist flexors and to these 2, possibly 3 fingers in the hand, depending upon what resource you use. With that said, for doing the median nerve flossing, if it's been tested out and determined that you need to do flossing for this nerve, how you're going to do it is to try to put your hand on the wall first with your fingers facing back. Some people don't have the wrist or hand mobility to do this, and if you can only do it comfortably with your fingers facing up towards the ceiling, that's okay. But if you can, point your fingers back behind you, I encourage it. Now, in this position, the median nerve is pulled or tensioned from the side of my arm. So if I'm flossing where I'm trying to pull from the neck end or the top end and then the bottom end or the arm end, if I'm on tension here at the arm, I need to have my head tilted to the right or the treatment side, and I'm going to be holding there for 2 seconds to provide slack from the neck. And then, as I'm bending my elbow to provide slack from the bottom end or the arm side, I'm actually going to bend my head to the left or away to pull on that median nerve a little bit from the neck end. And then as I straighten my elbow, I'm going to bend my head back to the right, holding each position for 2 seconds. Bent elbow, head bent away or to the opposite side, and then with my elbow straight, I'm bending my head back towards the side that I'm stretching. Repeating 15 times the first time you do it to make sure that this is going to be effective for you, if it is. So now that we've got the median nerve floss, where we pulled it from one end by putting our arm like this and provided slack on the other end before we reversed things, hopefully it will be moving a little bit better that now we can tension it. And again, for tensioning any nerve, it shouldn't be done for anything that's acute, new, or inflamed, or anything that's really, really, really sensitive. You should always try flossing first, and then if tolerated, then you can try tensioning. So for tensioning the nerve, the median nerve, what we're going to be doing is putting our hand in that position again, if we can, with our fingers facing back and with our elbow straight, and then we're going to bend our head away. We're going to hold here for 2 seconds, and then we're going to relax. You can either relax your arm by bending it and tilting your head back to the right, or just leaving your head in the middle, or just relax your arm down to your side. But we're going to do 15 times where we're going to gently go as far as we comfortably can with the elbow straight, the hand facing backwards, the head tilted to the left, holding for 2 seconds each time. Repeating 15 times, hopefully that nerve should be moving a lot better afterwards, and if your symptoms are related to it, hopefully they will be better as well.